So this video is all about Leopold's maneuver. Leopold's maneuver is used to determine the position of the baby inside the mother's womb. This preferable formed after 24 weeks of gestation when fetal outline can be already palpated. The maneuvers are not truly diagnostic. The actual position can only be determined by ultrasound performed by a competent professional. So for the factors that affects the performance of the maneuver, first, it is difficult for the obese woman, woman with hydramnios, and then woman with full bladder. So hydramnios, it is a condition in which excess amniotic fluid accumulates during pregnancy. For the nursing considerations, first is to instruct the woman to empty her bladder first. Second is to drape properly to maintain privacy. Third is to explain the procedure to the client, and then so we're doing this to avoid abdominal muscle tensing. Warm your hands by rubbing them together, and then use the palm for palpation and not the fingers. So the purpose of the methods of palpation is to determine presentation and position of the baby or the fetus and aid in the location of fetal heart sounds. So assess for the client's age of gestation and urinary bladder fullness. So first, let us verify the patient. Kung tama ba yung pasyenteng na-attendan mo na yon, and then make sure na nakaihi yung pasyente, hindi full yung kanyang bladder bago mo gawin yung Leopold's maneuver. Hi, Mrs. Bautista. I am Nurse Skyline. I will be doing Leopold's maneuver, which means I'm going to put my hands on your stomach to determine the position of the baby. Is that okay? Empty your bladder first. Okay, sa first maneuver, ang question, what lies at the fundus? Ano nga ba una nating mapapalpate dyan? Yung kanyang head ba or yung baby's buttocks? First maneuver is also called the fundal grip. Sa first maneuver, dinedetermine natin whether it's head or buttocks. Sabi nila, heads are firm and move independently, and buttocks are soft and moves along with the body. So for the second maneuver, the umbilical grip, ang tanong natin naman, where is the fetal's back? The second step, we're gonna be looking for the baby's back. So we're gonna place our hand on the side, and the one hand is for palpating and the one for assisting, and ayun, vice versa. So in here, we're gonna feel that the back is flat and long. So this is important to know because this is where we're going to place a heart rate monitor on the baby's back, and the side where the baby's back is, that's when we're going to get the most accurate heart rate tracing. So here in second maneuver, we are going to determine the location of the fetus back, and the back should feel firm and smooth, and the extremities are small and all bent. So for the third step or third phase, this is called Paulick's grip. Tanong dito, what is in the inlet? So in this phase, we're gonna be determining the part in the pelvic outlet. It states that the head may or may not be engaged. So, paano nga ba natin malalaman kung engaged na yung ulo ng bata or hindi pa? So, dito sa step 3 na to, yung Paulick's grip, gagawa tayo ng parang ganyan. L na yan. And then, sabi dito, kapag na-touch or napalpate natin yung ulo ng bata and parang nagagalaw natin ganun, it means hindi pa engaged yung bata, matagal pa lalabas. So, pag hindi natin nakapa, ibig sabihin nun, malapit na lumabas yung bata and then engaged na siya. So, for the fourth maneuver, the pelvic grip. What is the attitude? It could be good attitude or bad attitude. Good attitude if bro respond to the side that contain the elbow and the knees. And poor attitude if examining fingers will meet an obstruction on the side as the fetal back. So here in the fourth maneuver, we are determining cephalic prominence. The brow should be on the opposite side of the back. So the fourth step, start from the bottom and then fill up, verifying positioning of the baby. And then the side where the greatest resistance to the descending fingers is the location of the brow. And syempre after that, assist the client to get out from bed and keep all the materials used. And before and after touching the patient, always do hand hygiene. And then always record your findings on the client's record and refer.